Doctors may prescribe $80 pills, but this 80-cent kitchen powder, used the right way, can shut down 10 silent health problems that ambush us after 60. Let me show you exactly how. Open almost any kitchen cabinet and you'll spot a humble orange box or a plain white bag labeled sodium bicarbonate. For most people, it's just for cookies, a fridge deodorizer, or a quick fire extinguisher. But emerging research shows that when used wisely, inside the body, on the skin, and even in the mouth, plain baking soda can quietly diffuse 10 common problems that rob adults over 60 of energy, comfort, and quality of life. We're talking relief from acid reflux, calmer arthritis, cleaner teeth, faster muscle recovery, fewer urinary infections, and more. In 2024, the Journal of Gerontology called sodium bicarbonate one of the most underappreciated therapeutic powders of the century, noting its safety record, its pennies per dose cost, and its unique ability to neutralize metabolic, microbial, and mechanical stressors. Today we'll unpack 10 hidden health issues baking soda can tackle, the exact protocols, the latest science, who should be cautious, frequently asked questions, and a few myths that still float around Facebook. Everything you hear is educational, not medical advice. Consult your healthcare professional, especially if you take blood pressure pills, diuretics, or have kidney or heart disease. If you're new here, welcome to the Unfiltered Apothecary, where we dig up science-backed remedies hiding in plain sight. Like this video, subscribe, and drop your country in the comments so our senior wellness map keeps growing. Let's dive in. Now let's get into the 10 hidden health issues that baking soda can help solve for seniors. Heartburn feels obvious, yet many seniors experience what's called silent reflux that damages the vocal cords and esophagus without that burning sensation. 1 teaspoon of baking soda stirred into half a glass of water creates a gentle, alkaline drink that, honestly, neutralizes hydrochloric acid within seconds. A 2025 BMJ Open Gastroenterology trial found this simple mixture actually outperformed over-the-counter chewable antacids at relieving symptoms in adults over 60, with fewer bloating complaints. How to use it: just mix half to 1 level teaspoon in 200 milliliters of room temperature water, sip slowly, and limit to 2 doses per day, no more than 3 days a week. After age 60, kidney filtering efficiency drops, sometimes allowing acid to build up in the blood, which can weaken bones and muscles. In a landmark 2024 randomized trial in the American Society of Nephrology, seniors with stage 3 kidney disease, who took 600 milligrams of food-grade sodium bicarbonate twice daily, slowed kidney decline by 35%. How to use it: only under doctor supervision. Typical dose is 1/4 teaspoon morning and night, taken with plenty of water, with regular blood tests for potassium and sodium. Baking soda toothpaste isn't a gimmick. Its mild abrasiveness lifts plaque while its alkalinity stops acid-loving bacteria from releasing those foul sulfur gases. A 2023 Journal of Clinical Dentistry study showed brushing with a 65% baking soda dentifrice reduced plaque 60% better than a silica paste in people over 65. How to use it: just dip a damp, soft bristle brush into a pinch of baking soda once daily, gently polish for 1 minute, then rinse. So, about 80% of urinary tract infections in older women actually start in acidic urine that encourages E. coli to thrive. The alkalinity of baking soda can help raise your urinary pH, which eases that burning sensation and just makes things a lot tougher for those pesky microbes. A recent Japanese pilot study from 2024, involving patients with recurrent UTIs, found that symptoms dropped by 40% after 4 weeks of taking 1/8 teaspoon of baking soda in water each morning. Here's how to use it: just dissolve 1/8 teaspoon in a tall glass of water once daily for up to 7 days, and of course, keep following whatever treatment your doctor recommends. Uric acid tends to crystallize in acidic blood, but if you raise that pH, those crystals can actually dissolve. There was a 2025 Arthritis and Rheumatology crossover study that found half-teaspoon doses of baking soda, taken twice daily, lowered serum uric acid by 0.9 milligrams per deciliter in 8 weeks, which is enough to reduce how often those flares happen. Here's how you use it: half a teaspoon in water, morning and evening, but always, coordinate with your rheumatologist if you're taking allopurinol or febuxostat. High-intensity exercise like sprints builds up lactic acid and sodium bicarbonate. Yep, that's baking soda, helps buffer it. In a 2024 sports medicine review, masters-age cyclists who took 0.3 grams per kilogram of body weight of baking soda an hour before sprinting were able to maintain their power 17% longer. If you want to try it for tough workouts, just mix 1 teaspoon per 5 ounces of water, sip it slowly over 30 minutes, and honestly expect some burping. It's smart to start with half doses first to see how your stomach handles it. Soaking in a lukewarm tub with baking soda, yeah, it really helps calm down histamine-driven itch and softens those stubborn scales. Dermatologists in a 2023 Prague trial actually prescribed a quarter-cup baking soda bath 3 times a week, and, seniors with eczema reported about 45% less itch on the validated visual analog scale. So here's how to use it. Just dissolve 1/4 cup, which is about 4 tablespoons, in a standard bathtub, soak for 15 minutes, pat dry, and then moisturize. A baking soda and salt gargle, well, it thins mucus, loosens phlegm, and even changes your throat's pH enough to slow down viral replication. The American Dental Association in 2024 actually confirmed it can cut throat bacterial load in half compared to plain water. Here's how to use it. Mix 1/4 teaspoon baking soda and 1/4 teaspoon sea salt in 8 ounces of warm water. Gargle for 30 seconds, spit, and repeat 3 times daily at the first sign of scratchiness. Canker sores, they really hate alkaline environments. A 2025 randomized mouth rinse study showed baking soda solutions reduced pain scores by 38% within 3 days and, sped up healing. To use it, just mix half a teaspoon baking soda in half a cup of lukewarm water, swish for 30 seconds, spit, and repeat 4 times daily until it's healed. Back in 2018, researchers at Augusta University discovered that baking soda tea could actually flip immune cells from pro-inflammatory to anti-inflammatory, and they saw this effect in both rats and humans. Then, in follow-up human trials in 2024, it was confirmed that just 1/2 teaspoon daily lowered tumor necrosis factor alpha by 20% in folks with rheumatoid arthritis, which really helped ease that tough morning stiffness. To use it, just dissolve half a teaspoon in 8 ounces of water, sip it with snacks to help buffer the salt load, and, of course, keep an eye on your blood pressure. So, here are 5 safe ways you can use baking soda. For a quick drink, mix half a teaspoon in about 200 milliliters of water. It can help with reflux, gout, or arthritis. If you prefer a slow sip, dilute 1 teaspoon in 500 milliliters and drink it over 30 minutes before your workout. For an alkaline bath, add a 1/4 cup to your tub to calm itchiness or soothe sore muscles. For your mouth, try a dental dip. A pinch on a wet toothbrush or a 1/4 teaspoon in a warm rinse works well for gums, canker sores, or even your throat. And for targeted relief, make a paste with 3 parts baking soda to 1 part water, then spread it thinly on bug bites or underarms as a natural deodorant. If you have kidney failure or you're on dialysis, sodium and bicarbonate can build up in your body in unpredictable ways. So always check with your nephrologist first. Folks with heart failure or uncontrolled high blood pressure, listen up. Extra sodium can make fluid retention worse, so you'll want to keep a close eye on your blood pressure. For those who are pregnant, occasional use is probably fine, but using baking soda regularly could throw off your acid-base balance. If you're on a low-salt diet or taking certain diuretics, it's important to track your daily sodium totals. And if you're taking calcium channel blockers or lithium, definitely ask your doctor, since bicarbonate can change the blood levels of these medications. Watch for signs you might be overdoing it, like swollen ankles, shortness of breath, nausea, muscle twitching, or even prolonged belching. If you notice any of these, dial back right away and get medical help if symptoms stick around. Okay, let's do a quick lightning round of common questions. First up, is baking soda the same as baking powder? Nope. Baking powder has baking soda, plus acid salts and a bit of starch. The extras actually reduce its therapeutic alkalinity. Next, won't I get too much sodium? Well, half a teaspoon has about 630 milligrams of sodium, so that's about as much as a 1/4 teaspoon of table salt. Make sure to count it in your daily total and try to stay under 2,000 milligrams, unless your doctor tells you otherwise. Can you mix baking soda with apple cider vinegar? Technically, yes. but they neutralize each other, making carbon dioxide fizz in salty water, so, it's fun, but it defeats the alkaline purpose. Aluminum-free or regular baking soda? Pure baking soda never contains aluminum. That's a rumor that comes from confusing it with some baking powders. And how long does an open box stay good? About 12 months if it's sealed, or 6 months if it's sitting in your fridge absorbing odors. Best bet. Keep a fresh box just for remedies. Here's your daily checklist for safe use. Measure. Don't just eyeball it. Always use a level measuring spoon and stir thoroughly because undissolved granules can really irritate your stomach lining. Start small. A quarter teaspoon dose is a good way to test your tolerance. Space out your medications and wait at least 2 hours so the alkalinity doesn't mess with how your pills are absorbed. And don't forget to hydrate. Always follow any oral dose with at least 8 ounces of water. Baking soda costs less than a penny per gram, but honestly its uses stretch from digestion and immunity to joint comfort, oral hygiene, and even soothing your skin. By learning just a few simple techniques like drinking, rinsing, soaking, or making a paste, you can turn a forgotten box into a mini medicine cabinet that rivals anything you'll find at the drugstore. Here's your homework. Put a measuring spoon next to your baking soda box, pick one of today's 10 protocols that matches something you'd like to improve, and try it for 7 days. Keep a little log. Maybe your stomach feels lighter, your joints are calmer, or you're making fewer nighttime trips. Then let us know how it goes in the comments. If you got something useful from this, go ahead and hit that like button, share the video with a friend who's always reaching for antacids, and subscribe for more senior smart, science-savvy tips and to keep building your natural health toolkit. This is the Unfiltered Apothecary. Eat like a person, not a patient.